Hi, Assalamualaikum warahmatullahi wabarakatuh to all my friends and to Sir Muhammad Aizat bin Adnan. Today, I want to present to you guys about the aerobic and anaerobic training program. But before that, I want to introduce all my group members, which is the first one is me myself is Nur Syafiqah binti Zainal Abidin, and the second one is Muhammad Adin bin Muhammad Afandi. And the third one is Muhammad Amir Akram bin Zain Azman and Muhammad Iskandar bin Mat Rozi. And the last one is Yusaini Shazwan bin Yusfa Nizam.
Assalamualaikum and a very good evening to Sir Aizat and my classmate. Today my groupmate and I would like to present about aerobic and anaerobic training program. So before that I would like to introduce my groupmate, which is me, Muhammad Amir Akram bin Zain Azman, Nur Syafiqah binti Zainal Abidin, Muhammad Adin bin Muhammad Afandi, Muhammad Iskandar bin Mat Rozi, and also Yusaini Shazwan bin Yusfa Nizam. So next I would like to explain about acute response to aerobic training. So basically we have learned this topic in physiology with William Sherry. So I hope this presentation will refresh your knowledge about this topic. So do you guys still remember what is acute response? So acute response is immediate change in one or more of the body system in response to a stimuli. So for example of acute response is like heart rate. So when we exercise, our heart rate will increase immediately. So these are the example of acute response. Okay, next I would like to explain about cardiovascular response in aerobic training. So first we have cardiac output. So cardiac output is the amount of blood pumped per minute and is the product of stroke volume and heart rate. Cardiac output increase because of increase in stroke volume and heart rate. So when we see at the formula Q, which is cardiac output, equal to SV, stroke volume, times heart rate, HR. So when SV and HR increase, cardiac output will also increase. Next is stroke volume. Stroke volume is amount of blood pumped per beat. Stroke volume increase beginning at the onset of the exercise. Stroke volume can increase up to 50% to 60% of the resting value. Next is heart rate. Heart rate is the number of heartbeat per minute. So these are the one that we always count before or after exercise. Heart rate increase during exercise, but most people don't realize that it actually starts to pick up right before the start of exercise as a reflex. So if you guys realize that basically before we started exercise, our heart rate increased suddenly. So what happened actually, the sympathetic nervous system sent an anticipatory stimulation to get the heart ready for exercise. So that's why our heart rate increased before exercise, because it want to get the heart ready. Next is oxygen uptake. Oxygen uptake, or well known as VO2, is the amount of oxygen consumed by the body tissue. It also increases to accommodate the metabolic demands. Next is blood pressure. Blood pressure and blood flow increase during aerobic training. Systolic blood pressure is the pressure in the arteries during the heart contract, while diastolic blood pressure is pressure in the arteries during rest. For the last one is control of local circulation, where vasodilation and vasoconstriction happen. So vasodilation is when blood vessel dilate to allow more blood to come through and more oxygen to be transported. At the same time, there is vasoconstriction in the other organ system as a mechanism of prioritization, which means vasoconstriction is the constriction of blood vessel, which increase blood pressure. Next is the respiratory response in acute response for aerobic training. So we have gas response and blood transport and gases and metabolic byproduct. So in gas response, increase in the diffusion of oxygen from the capillaries into the tissues, as well as an increase in diffusion of carbon dioxide from the blood into the lungs. Oxygen is used in metabolism and carbon dioxide is produced. So this happen when we breathing. So when we consume oxygen and we produce carbon dioxide. For blood transport and gases and metabolic byproduct, the blood transport oxygen from the lungs to the cell of the body where it is needed for metabolism. The carbon dioxide produced during metabolism is carried back to the lungs by the blood where it is then exhaled. Like I said before, the only byproduct of the process of aerobic metabolism of carbohydrates are carbon dioxide and water. Our body disposes of this by breathing, sweating, and urinating. So we have done with acute response to aerobic exercise. Now we move on to chronic adaptation to aerobic exercise. So what is chronic physiological adaptation? So chronic physiological adaptation is changes to one or more of the body system as a result of long-term consistent stimulus such as exercise. So two example of chronic adaptation is like muscle mass and also body fat, because these two things are not changes immediately after exercise. For example, like you come to gym, you work out, your muscle mass doesn't suddenly get bigger, right? It may take time. So you come to the gym skinny and then suddenly you become bulky after workout. So actually these things takes time to increase the muscle mass and also reduce the body fat. Okay, these are the adaptation for aerobic exercise. We have cardiovascular adaptation, respiratory adaptation, neural adaptation, muscular adaptation, bone and connective tissue adaptation, and lastly endocrine adaptation. So we will go through one by one. So during cardiovascular adaptation, Qmax increase. Qmax is cardiac output maximum. Stroke volume also increase, which increase in chamber volume and thickness of left ventricle, increase contractility, and also increase endocardium elasticity. And next is decrease heart rate at rest and during submax exercise. Submax exercise is actually like moderate exercise. So logically during rest our heart rate should be decreased, right? So if your heart rate increase during rest, you need to go for medical checkup lah. There must be a problem with your heart. And next is increase capillarization or number of capillaries. Increase delivery, increase of capillarization can increase delivery of oxygen, nutrient, and hormone. It also increase removal of heat and metabolic byproduct. Next is respiratory adaptation. If the athlete is training at a maximal level, then there will be an increase in breathing frequency and tidal volume, which also can increase the air displaced in the lungs, so it can make the respiratory process go efficiently. The third one is neural adaptation. Nervous system play important role in early stage of aerobic endurance training. After long-term aerobic exercise, muscle contraction becomes overall more efficient, resulting in delay fatigue of contractile mechanism. After that is muscular adaptation. So athlete that train aerobic exercise will have higher percentage of aerobic power. The onset of blood lactate accumulation or OBLA occurs at a higher percentage of aerobic capacity. So OBLA determine whether the athlete is fit or not. If the OBLA happen early, that means the athletes are not fit, while when the obla happen late, it means the athlete are fit. Next is bone and connective tissue adaptation. It is possible for an athlete to experience bone growth as a result of chronic aerobic training depending on the age and training stimulus. However, the research shows that intense training such as running and high intensity aerobic can stimulate bone growth. Lastly is endocrine adaptation. Changes in hormone production that contribute to the body's adaptation to aerobic exercise are important. Testosterone, insulin-like growth factor, and growth hormone affect the integrity of muscle, bone, and connective tissue as well as assist in maintaining metabolism. Okay, last but not least, I would like to explain about the adaptation to aerobic endurance training. Aerobic endurance training reduce body fat, increase running economy. Running economy is how the runner utilize the energy efficiently during running. Next, increase respiratory capacity, improve enzyme activity, increase maximal oxygen uptake, lower blood lactate concentration at submaximal exercise, and also increase mitochondrial and capillary densities.
Assalamualaikum warahmatullahi wabarakatuh. My name is Muhammad Adin bin Muhammad Afandi, and today I would like to continue my group's presentation on aerobic and anaerobic training, and I will continue on my part, which is external and individual factors influencing adaptation to aerobic endurance training and also overtraining. Let's start. Okay, so there are a lot of variety of external and individual factors that can influence both acute responses and chronic adaptation of the cardiovascular and respiratory system to exercise. The factors are divided into two, which is external and individual. The external factors include altitude, hyperoxic breathing, smoking, and blood doping, while individual factors include genetic potential, age, and sex. Okay, so right now we're going to go to external factors. Okay, for the first external factors, which is altitude, at elevations greater than 3,900 feet, which is 1,200 meters off the ground, acute physiological adjustment begin to occur. It is to compensate for the reduced partial pressure of oxygen in the atmosphere. During elevation, two adjustments that occur early in the acclimatization process are particularly important. The two adjustments, which is the first one, there is an increase in pulmonary ventilation, also known as hyperventilation, at rest and during exercise. This increase in ventilation is primarily because of increased breathing frequency. With longer stays at high elevation, however, increased tidal volume also contributes to augmented ventilation. Stabilization of ventilation is dependent on the level of altitude and the duration at altitude. Okay, in the range of 2 weeks, 10 to 14 days, 2 weeks at a given altitude, heart rate and cardiac output began to return to normal values. It is because long-term acclimatization response of increased red blood cell production. Fourth one is prolonged altitude exposure causes chronic physiological and metabolic adjustment. The adjustment includes increased formation of hemoglobin, generally 5 to 15% increase, although higher values have been reported, and red blood cells, which is 30% to 50% increase. The second one is increase in diffusing capacity of oxygen through the pulmonary membranes. The third one is maintenance of the acid-base balance of body fluids by renal excretion of HCO and through hyperventilation. The fourth one is increased capillarization. Okay, for the second external factor, which is hyperoxic breathing, Hyperoxic breathing is basically breathing oxygen enriched gas mixtures during rest periods or following exercise has been proposed to positively affect some aspects of exercise performance. Taking in oxygen-rich gases during rest may bring about positive effects during exercise, but it is still controversial. It can also may increase the amount of oxygen carried by the blood and therefore increase the supply of oxygen to working muscles. Thus, the potential of hyperoxic breathing during rest periods or following exercise has yet to be fully educated. Okay, moving on to the third factors of external factors, which is smoking. Smokers experience impairment in lung function and at increase of risk for chronic obstructive pulmonary diseases, which includes chronic bronchitis and emphysema. The detrimental effects of smoking include increased airway resistance, which is due to nicotine-related bronchial constriction, or increase in fluid secretion and swelling at the bronchial tree due to the irritation of the smoke, and the paralysis of the cilia on the surface of the respiratory tract by nicotine. This which limits the ability to remove excess fluids and foreign particles, causing debris to accumulate in the respiratory passageway, adding the difficulty to breathe. The third one is the resulting of carboxyhemoglobin, which is the combination of carbon monoxide and hemoglobin from smoking reduces the amount of oxygen that can be carried by hemoglobin. This can result to the oxygen to reducing the amount of oxygen that can be provided to the working muscles. The fourth one is the reduction in oxygen carrying capacity may reduce maximal exercise capacity and submaximal cardiovascular responses. This which may increase in an effort to provide adequate oxygenated blood to the working muscles. And the fifth one is the increase in catecholamine release increases heart rate and blood pressure. Alright, so moving on to individual factors. The first one, which is genetic potential. The upper limit of an individual's genetic potential contributes significantly to the absolute magnitude of the training adaptations. It is because each biological system adaptation, such as that have the cardiovascular system, has an upper limit, and as the athlete gets closer to the upper limit, smaller and smaller gains are observed. The magnitude of change also depends on the current training status of the individual. Okay, the second one is age. Maximal aerobic power decreases with age in adults as a consequence of various physiological changes that accompany aging. For example, reduced muscle mass and strength, also called sarcopenia, and increased fat mass. The third one is sex. On the average, when women and men are matched by age, the aerobic power values of women range from 70% to 85% of the values of men. The differences in aerobic power may be caused by several factors, which includes women's higher percentage of body fat and lower blood hemoglobin values, and men's larger heart size and blood volume. So right now I'm gonna explain to you about overtraining, which includes definition, prevalence, diagnosis, and potential markers. Alright, so the definition of overtraining. Overtraining is exceeding the ability of the athletes to recover, which also mean overtraining also considered as a process that can result in overreaching in the short term, which is functional overreaching, or extreme overreaching, also known as non-functional overreaching, or OTS, overtraining syndrome, in the long-term period. The prevalence of overtraining syndrome. A recent study indicated that about 10%, 7% to 21% of collegiate swimmers and other aerobic endurance athletes experience either non-functional overreaching or overtraining syndrome. The diagnoses are overtraining syndrome, OTS, chronically overtrained state that require months to recover from. Functional overreaching, temporarily exceeding the level that a person can recover from. Functional overreaching, it is a training purposely intensified to cause a brief of decrement in performance followed by a few days or weeks of recovery. The result is a super compensative improvement in the performance. An example is a final maximal training session which caused functional overreaching a few weeks before a competition, followed by a gradual tapering period leading up to an enhanced performance. Non-functional overreaching extreme, long-term exceeding the level that a person can recover from, which means non-functional overreaching is characterized by a stagnation or decrease in sport performance, with recovering requiring weeks to months, longer period of time, in order for the athlete to return to the previous level of performance. If intensified training continues without adequate recovery, an athlete can progress to overtraining syndrome, in which performance is decreased and which for months of recovery would be required to return to the athlete prior level of performance. The potential markers are the first one is heart rate can increase or decrease in response to overtraining syndrome, and the second one is decreases in the rate of free testosterone to cortisol of more than 30% may be a potential marker of overtraining syndrome. That's all from me. Thank you.
Okay, for conclusion of aerobic endurance training is a potent stimulus to physiological changes in the cardiovascular, respiratory, skeletal muscle, metabolic, endocrine, and skeletal system, and has a substantial effect on your body composition and performance. Then, so to be a highly effective personal trainer, it is crucial to have a clear understanding of both the acute response and chronic adaptation of the many psychological systems of the human body. Alright. So to understand how the body adapts to the overload of aerobic exercise is critical to designing effective exercise training program, monitoring exercise response and progress, and also assessing training outcomes. So what the personnel must to do? Okay, the personnel must to do is need to recognize the effect that genetics, sex, age, specificity of a training and detraining have on physiologic response and adaptation. Okay. So all of this the personal trainer need to recognize first.
Hi and Assalamualaikum warahmatullahi wabarakatuh. My name is Muhammad Iskandar bin Maruzis. So today I'm going to try my best to explain to you about neural adaptations, muscular adaptations, connective tissue adaptations, and also endocrine responses and adaptations towards anaerobic training. So moving on to the first title is that neural adaptations. Whenever you do anaerobic training, for example like strength training and all that, you will have the potential to obtain a long-term adaptations throughout the neuromuscular systems, beginning in the higher center brains and continuing down to the level of muscle fibers. What does this mean is that you will have much more control in the movements and stability in both skeletal and smooth muscle function. Moving on to the second point, whenever you do aerobic training, you will also increase the neural drive, and by increasing that, you will have augmented against muscle recruitment, improved your neural firing rates, and also will have a greater synchronizations in the timing of neural discharge. So from my understanding about what is neural drive is, in a simple term, it is how your brain talks to the muscle. Meaning, if you say, hey arm, I want to do a bicep curl, so I want you to curl the muscle really hard, and the initiation of that comes from the brain, and also the ability to maintain it or increase the intensity of the movement is also comes from the brain. Moving on to the last point, which is a reduction in inhibitory mechanisms is thought to happen with a long-term training. While it is not fully understand how this complex response occurs, it is apparent that neural adaptations is happen before any structural changes in the muscle are apparent. What does this mean is that before you get to notice your biceps, for example, it is getting bigger and bigger due to muscle hypertrophy by doing strength training, neural adaptations in your body has already occurred before you notice the muscle hypertrophy. Moving on to the next slide, which is muscular adaptations. Skeletal muscle adaptations following anaerobic training occurs in both structure and function. Collectively, these adaptations will enhance performance characteristics that includes power, strength, and muscular endurance, all of which are very critical to athletic success. So, for the first point, which is muscular growth. So, muscular growth, it means that the muscle will get bigger and bigger, or in another term is muscle hypertrophy. So when you do anaerobic training, muscular hypertrophy will occur, and it takes more than 16 workouts before significant changes are apparent, but you cannot do it in a one straight session. It takes proper time of rest, proper nutritional intakes, and in the second point, it depends on the training prescribed. So in order to optimize muscular growth, appropriate training periodization is essential. Just like we learned back in the diploma days, it takes 8 to 12 reps and 30 seconds rest in between sets in order for you to achieve muscle hypertrophy. The second point is fiber size changes. Type 2 fibers will increase in size following anaerobic training. It has been argued that the ultimate potential for hypertrophy may reside in the relative proportion or type 2 fibers within a given athlete. That is, athletes who genetically possess a relatively large proportion of fast-twitch muscle fiber may have a greater potential for increasing muscle mass than individuals possessing predominantly slow-twitch fibers. Moving on to the third point, which is other adaptations. So, sarcoplasmic reticulum and T-tubule density will be increased, and these changes act to facilitate hypertrophy, and it enables greater expressions of muscular strength. Sprint training has been shown to enhance calcium release, which assists in increasing speed and power production by promoting actin and myosin cross-bridge formation. Moving on to the last points, which is structural changes. Resistance training has been shown to increase the angle of penetrations in pennant muscle. Pennant muscle is a muscle that attached to its tendon. This type of muscle allows a greater force production but a smaller range of motion. And research has been shown that strength trained athlete has been displayed a larger penetration angles in the triceps brachii compared to untrained individuals. Moving on to the next slide, which is connective tissue adaptations. So the first point is anaerobic training and bone growth. Anaerobic training will stimulate bone growth, and bone growth will be stimulated by the exercise that appears to stimulate muscle hypertrophy and strength. By doing anaerobic training, it will give out mechanical forces that will cause deformation on the specific part of the skeleton. So in response to that, osteoblasts will migrate to the bone surface and begin bone remodeling. It will secrete protein, which is primarily collagen molecules that will be deposited in between the bone cells in order to increase the strength. Moving on to the second point, which is principle of training to increase bone strength. So let's take an example like variation principles. It will give a unique stimulus for a new bone formation. It will also increase bone strength in various directions. So based on these points that I have just said, you can conclude that variation principles not only prevent you from getting a boredom, but it will also increase your bone strength because you attack a new specific skeleton in your body. Moving on to the last point in connective tissue adaptations, which is adaptations of tendons, ligaments, and fascia. So when you do anaerobic training, obviously your connective tissue will grow and it will increase in collagen fibril diameter and an increase in the packing density of collagen fibrils. For the next slide, which is endocrine response and adaptations to anaerobic training. The first one is acute anabolic hormone responses towards anaerobic training. Elevated concentrations of testosterone, molecular variants of growth hormone, and cortisol have been found for up to 30 minutes in men. The magnitude of elevations is greatest when large muscle mass exercise are performed. Besides that, insulin-like growth factor 1 (IGF-1) has a delayed response to exercise and is dependent upon the acute growth hormone response. The second one, which is chronic changes in the acute hormonal response. The longitudinal changes in endocrine function reflect the increased exercise stress being tolerated by the body response to incremental external loading. Besides that, any chronic adaptations in acute hormonal response patterns potentially augment the ability to better tolerate and sustain prolonged higher exercise intensities. The third one is chronic changes in resting hormonal concentrations. Chronic changes in resting hormone concentrations are unlikely to happen. Instead, it is likely reflect the current state of the muscle tissue in response to substantial changes to the training program and nutritional factors. Besides that, elevation during and immediately following a workout may present enough stimulus for tissue remodeling. The last point is hormone receptor changes. Resistance training has been shown to upregulate androgen receptors (AR) within 48 to 72 hours after workout. Besides that, the resistance exercise stimulus appears to mediate the magnitude of acute AR modifications.
So now we move on to the next slide, which is the type of anaerobic training. So based on the slide, we have three, which is first, weightlifting, second is sprinting, and the third one is high intensity interval training. So we go for the weightlifting first. Weightlifting, you can either use your body weight or equipment such as barbell or dumbbell. So these are the method or intensity for the exercise. Start with one set of 8 to 12 reps for the first 4 weeks. Increase to 12 to 15 reps for the next 4 weeks. Then when performing 15 reps becomes easy, add a second set of reps, means you do 2 sets for the exercise, or you can increase the weight, such as before this you do bicep curl 5 kg. So when you feel that 5 kg is too light, then you can try bicep curl with 100 kg padu. Okay, next is sprinting. So sprinting, you guys already know what it is. So the method or intensity is first Take your first sprint at a moderate pace, about 50 to 60% of your maximum effort. Sprint for 30 seconds. And after that, for the active recovery, slow down your speed or walk for 60 to 120 seconds. And then you sprint back, sprint for 30 seconds at 70% maximum effort. You increase your effort. And next, you continue recovery, slow down your speed or walk for 60 to 120 seconds again. Then you sprint for 30 seconds at 80% maximum effort. Your maximum effort increase again. And lastly, slow down your speed or walk for 60 to 120 seconds again. Lastly is high intensity interval training, or HIIT. It involves short bursts of intense exercise alternate with low intensity recovery period. For example, like using a stationary bike, pedal as hard and fast as possible for 30 seconds, then pedal at a slow, easy pace for 2 to 4 minutes. Repeat this pattern for 15 to 30 minutes. Other example is after jogging to warm up, sprint as fast as you can for 15 seconds, then walk or jog at a slow pace for 1 or 2 minutes. Repeat this pattern for 10 to 20 minutes. If you can see, this method, if you compare with the sprinting before, the slightly same method that they use. You sprint, and then you slow down your sprint, you walk, and then you continue to sprint again. Okay.
Okay, now I will talk about the cardiovascular and respiratory response to anaerobic exercise. The definition: both acute bouts of anaerobic exercise and long-term anaerobic training have a significant impact on cardiovascular and respiratory function. This is reflected in both anaerobic athletes and sedentary individuals. For the first one, where enhanced cardiac function and dimension are apparent. The second one, heavy load resistant training can benefit the cardiovascular system, but differently from resistant training with more repetition or of light loads and less rest of conventional aerobic endurance training. And the last one, which is the third one, improve ability of the heart, lungs and circulatory system to function under condition of high pressure and force production can prepare the athlete's body for the extreme demands of sporting competition. In this slide, there's 3 parts, which is acute cardiovascular response to anaerobic exercise. Second one is chronic cardiovascular adaptation at rest, and the last one is chronic adaptation of the acute cardiovascular response to anaerobic exercise. For acute cardiovascular response to anaerobic exercise, the first one, an acute bout of anaerobic exercise significantly increase cardiovascular response. Heart rate, stroke volume, cardiac output and blood pressure all increase significantly during resistant exercise and increase blood flow to active muscle. Second one is generally the blood pressure response increase non-linearly with the magnitude of active muscle mass and is higher during the concentric pace of each repetition than during the eccentric pace, especially at the sticking point of an exercise. For the chronic cardiovascular adaptation at rest, the first one, the effect of anaerobic training modalities on resting heart rate remains to be fully elucidated. Short-term resistant training has been shown to decrease resting heart rate between 5% to 12%. Therefore, heavy resistant training does little to enhance resting cardiac function, but greater improvement may result from adaptation to a high volume program with short rest period. For example, bodybuilding circuit training. in which the overall continuity of the exercise stress in a workout is much higher. Okay, the last one is chronic adaptation of the acute cardiovascular response to anaerobic exercise. The first one is chronic resistance training reduce the cardiovascular response to an acute bout of resistant exercise of a given absolute intensity or workload. And the last one is lastly, oxygen extraction in generally not improved with resistance training using heavy loads and low volume. It is enhanced to a greater extent with continuous aerobic exercise or perhaps slightly with a resistance training program using high volume and short rest period. For the compatibility of anaerobic and aerobic modes of training. The first one is strength or power training work capacity. Endurance training have divergent physiology that present a programming challenge to the strength and conditioning professional working to optimize concurrent gains in both these physical and physiological characteristics. And the second one is combining resistance and aerobic endurance training may interfere with strength and power gains, primarily if that aerobic endurance training is high in intensity, volume or frequency. And the third one is power development appears to be negatively affected more than strength during concurrent high intensity resistance and aerobic endurance training. And the last one is the sequence may play a role in magnitude of adaptation.
Assalamualaikum warahmatullahi wabarakatuh. Hi, I am Yusani Shazwan. I hope everyone are doing well. I will present to you about overtraining for anaerobic. Okay, so what is overtraining? Overtraining is we will define as excessive frequency, volume or intensity of training that result in extreme fatigue, illness or injury. Overtraining often because of lack of sufficient rest, recovery or maybe in nutrient intake. And then overtraining, in other words, it can be a result for overreaching. For overtraining, there are three markers of anaerobic training, which is a psychological effect, hormonal effect, and performance effect. Okay, we go first a psychological effect. It will decrease your desire to train, and it will decrease your joy from training as well. Okay, so when you push yourself to do more exercise without rest, after that you will your desire to train will decrease, and then your emotion, which is your enjoyment, will decrease also from your training. Okay. Then for hormonal effect, acute epinephrine and norepinephrine increase beyond your normal exercise induced level. Okay, what is epinephrine and norepinephrine? Okay. Epinephrine and norepinephrine are two neurotransmitters that serve as hormones. Okay, these hormones will influence you. It will influence different part of your body and stimulate your central nervous system. Either you have too much or too little of this hormone, maybe it will affect on your health. Okay. Then okay, for sympathetic overtraining syndrome. Okay, obviously it will there are a lot of syndrome for sympathetic overtraining, which is restlessness or excitability, disturbed sleep, weight loss, accelerated resting heart rate, and delay recovery. So from that, we go to the third one is a performance effect. Because of these symptoms, your performance will decrements. Okay. Okay, next we continue. Okay, mistakes that can cause anaerobic exercise. Chronic use of high intensity or high volume or a combination of both and too fast development rate. Okay, this explains about you want to use more high intensity or high volume. It means like you rushing to use of high intensity training or high volume without rest. For example, in football training, you keep yourself to do more interval training or high intensity training as well, so, without rest. So from that, you will have overtraining. When overtraining occur, of course your performance will decrease. Okay, next, hormonal markers of anaerobic overtraining. Okay, this point is explain about hormone. In our body, there have two hormones, epinephrine and norepinephrine. Okay, in epinephrine they have adrenaline. So this adrenaline will push our performance. Okay, for example, okay, in training, epinephrine and norepinephrine sometimes rising erratically. Because of that, the performance will decrease. Okay, next, the last one is psychological factors in excessive training. Psychological changes are often observed before a decrease in actual performance occur. Okay, this is explained about psychological. Okay, when you have overtraining, of course you don't have interest in training and you lost your passion to do training. For example, nowadays they have a COVID-19 situation. Before a COVID-19 occur, the they have a competition. It called SUGMA. Okay, before COVID-19 occur, mostly the athlete do training hard because they want to face SUGMA competition. After when COVID-19 occur, they hear the news about the SUGMA is cancelled. So from that, it will affect their psychological, and of course their performance will also decrease. Okay. Alright, next, detraining. Okay, detraining. Okay, as you know, do you remember about a principle of training? They have a lot of principle. One of them we call it reversibility. Okay, reversibility means the athlete can lose the effect of training when they stop. So they can gain the effect when they want to begin to train again. Okay, reversibility as a not as detraining. Detraining occur within a relatively short time period after an athlete ceases to train. So performance will reduction, or we can call, may occur in as little as 2 weeks or sooner. Okay, detraining, the ways in which the body responds to detraining are analogous to the ways in which it responds to training. Okay, I will give the example. When someone or athlete, once training is stopped, the muscular endurance will decrease after only 2 weeks. It takes only 2 weeks. Okay, after 4 weeks, when someone want to stop the training, it show reduction in the training muscles respiratory ability, decrease in glycogen levels, and increase in lactate production that demonstrate obvious changes in the muscle metabolism. This thing will decrease after you stop your training. Okay, for conclusion anaerobic. Okay, what I can conclude about anaerobic is, as you know, anaerobic training, they have a lot of training, right? A lot of exercise such as resistance, sprint, plyometric, agility, high intensity interval training. Okay, this exercise will adapt in the nervous system that lead to a greater recruitment, synchronization, and enhanced muscle function that will enable to increase your strength and power. Okay, for the anaerobic exercise, that will, when you do exercise, it will improve your neuromuscular, musculoskeletal, endocrine, and cardiovascular function. This thing will contribute you to increase muscle strength, power, hypertrophy, muscular endurance, and motor performance. All of that will contribute you to improve your athlete performance.